This meeting is being recorded.
So we will this presentation will follow this outline. We will first underline what we are doing in terms of participation. Then we will focus on stakeholder engagement, and then we will move to communication and awareness campaign, as well to engagement with CAHWs. And finally, we will present what will be next with the project in terms of engaging with stakeholders. So participation is really at the heart of our project. But this year we did not apply participatory survey in the field to collect data. But conversely, we went back to stakeholder with our findings. So all the results that were generated following the surveys in epidemiology, socioeconomic, and mobility, we have conducted the past years in Bauchi and Plateau. So we organized a stakeholder meeting with private and public animal health actors in VOM. And we have some feedback meetings to come with communities, with farmers we have met and interviewed during our surveys. So the aim of these meetings is to present the key results of the project, some recommendations that we have established based on these results. But also what is very important for us is to get feedback from animal health actors, from the communities on our results and on the interpretation we made. So this kind of activity, it's really about engaging non-academic stakeholders in knowledge production. And the aim is really to have a co-learning process between researchers who come with their expertise, but also non-researchers who also have a strong expertise, and especially on what is ongoing in the field. Another example of how we are applying participation in the project, it's also the way we have defined our monitoring and evaluation plan. So doing so, we do not aim to meet only the indicators of the log frame, but also to meet the needs of the different categories of stakeholders. So we co-designed an evaluation plan during a participatory workshop that took place in VOM last year, and where all partners of the project were represented by one or two staff. So the aim is really to develop an evaluation plan focused on the needs of users. So we start by identifying the information that are relevant for the different categories of stakeholders. So partners, but also animal health services. And based on that, we define evaluation questions to be answered. And the next step now is to go to the field and to interview private and public animal health providers, communities, and project partners to be able to measure the different changes we need to address to answer our evaluation question. And during this collection data phase, it's also for us an opportunity to engage with communities and with private and public animal health providers by asking them their feelings about the project scope and activities, and also to discuss with them potential ways of improvement of the activity, how the project could have done better for potential next project. So developing the monitoring and evaluation plan in a participatory way, it's really a way to have a shared ownership of the monitoring and evaluation plan and of its results by all partners and beneficiaries. Another activities where we use participation, it's to work on one of the main output of the project, which is to develop and provide an information system to support all actors engaged in the surveillance and control of disease, and in particular PPR and ND. So this information system for disease surveillance and control is co-designed with stakeholders. So we have implemented a participatory workshop with central and local stakeholders. We first start by designing collectively the health information flow to better understand who are the actors at stake and what kind of interaction exists between them, and especially in terms of exchange of data and information. And then this step was followed by a co-construction step of the information services that are needed by users. So during this workshop, participants identify the information services they need to meet their activities, their missions in relation to surveillance and control of diseases. And for example, they identify the need to have an early warning system, an alert system, in the form of a map displaying the suspected and confirmed case of disease. They also identify the need to have an intervention support tool with a list of all the available human resources in the area they can mobilize when they need to go to the field to control an outbreak, but also data about vaccination coverage and so. So for this participatory activity, the next step now is to develop these information services and to define with stakeholder the access rules of these information services. So in this kind of approach, the researchers are coming with methodology and tools, but all the knowledge is really coming from the stakeholders. So I am done with my part. Jesu Tommy, if you want to take the floor and to go further with the presentation, and I will move slide for you.
All right, thank you, Marianne. Thank you very much. Good morning, everyone. And so we'll continue with external and internal stakeholders engagement. We did this through the webinar that was held in 2023. It was centered on disease reporting. So it was targeted at engaging communities in disease reporting, a necessity for achieving effective animal disease surveillance in Nigeria. And the webinar was quite productive. We were able to get feedback from participants. The objective was mainly to showcase the project efforts in equipping community animal health workers and also supporting them with the tool for disease reporting. And so from their interactions with farmers on the field, the diseases they encounter, they send the information ASAP. So this helps in quick investigation and mitigation strategies. And so we're able to showcase what they've done in terms of reports, the number of reports they've been able to really submit, and we presented that effort. We got feedback from participants, and part of the feedback we got is the desire for the LIDISKI program, this kind of intervention, to be done also in 2 other states at least. So there was also the request for a proper management of the community animal health workers program to avoid quackery, and this sort of feedbacks helped us to, really put structures in place. And on the project, we have linked the community animal health workers to supervisors, and so all this has been put in place and is running well as a system. Next slide, please. Also on the social media and on the website, we have continuous engagement with the external community. Information about the project goes out on the website and on our social media networks. And we had new users visiting our website seeking for information. And we also had a good number of impressions on our social media and on our website. Also, there is a YouTube channel. So for anyone participating here with us who wants more information and you want to see the things we've been able to do over the past 4 years on the project, you can easily check for LIDISKI Communications on the YouTube. You would have access to many of our videos there. Thank you. Next slide. Yes, we were also able to reach the external community through a radio interview that happened last year as well. It had the objective of raising awareness about the pest ruminant disease and the Newcastle disease. And we were able to also reach a good number of people. The radio station is the Independence Radio, and it has a reach across Kaduna, Niger, Nasarawa, and Kogi states. We're able to reach a good number of people, 2 million people. And so the essence is to raise awareness about the disease, even among the masses, for people to be aware that, yes, when you see your livestock dying, this could be the possible reasons. Next slide, please. Yes, we also had engagement with the CAHWs and the distributors. We were able to facilitate good engagement between these 2 groups, and the distributors were able to, the distributors and vaccine suppliers were also able to supply the community animal health workers with continuous vaccine supply. And so CAHWs had enough vaccines, as against what was the situation before. The challenge was usually that community animal health workers do not have enough vaccines at hand to meet the demand from farmers. But our distributors and vaccine suppliers were able to help the CAHWs and provide as needed. Next slide, please. Yes. To also facilitate engagement with between community animal health workers and farmers, we provided them with banners. We were able to support them with banners, 138 in number for each community animal health worker, to be able to increase their visibility in their communities. Many of them have shops, and then in their houses as well, on their streets, they were able to put these banners to raise awareness. And so this increased the patronage that they had from farmers. And it also increased the number of reports of diseases that were submitted on the open data kit. Next slide, please. Yes, also the engagement with farmers that the community animal health workers have has helped them. It has increased their capacity and their sales as well. So they recorded increased sales, and it has also helped them to establish businesses. And so in 2022, we had 3 community animal health workers having shops, but from 3 now it has increased to 12, and then they are doing really very well in their business establishment. Some of the cows were even able to purchase solar fridges, and this has really helped them in providing more vaccines to meet the demand in their communities. Next slide, please. Yes, so now lessons learned from our engagement with all stakeholders on the project. So for the stakeholder engagement, we realize that stakeholders in high prevalence areas, as indicated by LIDISKI mobility study in Bauchi, attest to great improvement following the adoption of vaccination. Okay, so usually places that are known to be prone to high disease entry, where it's easy for disease to come in, those places when the sellers, the market men, market women, the poultry and livestock vendors there were sensitized. We realized that they got the information about vaccination, and after adoption, it is recorded that there was great improvement. And so there is need for proper planning now and awareness on the best period of the year for PPR vaccination. So that's one of the recommendations we have, that there has to be proper planning for when the awareness, for when the vaccinations, the annual vaccinations will be taking place. And then the communication and awareness campaign activities, we realize that the information, education, and communication materials that we produced on the project give information about the disease symptoms and what to do for farmers when they discover that these symptoms, these clinical signs are found in their animals. And so we have that information on those flyers and posters, and they were produced in Hausa and in English. But we realized that contrary to the general perception that Hausa language is the general language for the northern part of Nigeria, we realized that some communities, they have different dialects and they are not so strong. So to be able to get the information to them in the language they understand, they are not so strong in Hausa, so it's better to channel this information to them through their own indigenous languages. And so these are some of the lessons we learned on the project. So also for our radio jingles as well. So these are lessons we learned, that we should channel this information through languages that they understand best. Okay, and activation events, we realize that they are more effective than radio jingles, because it's the general perception that radios, it's easy, many people tune into their radios and they get information from there. But we realize that at the grassroots, not everybody is even a radio person. And so in those communities, we realize that activation events it gets closer to them. It's closest to them. It gets them involved and gets the information close to them. And then community animal health workers' engagement with farmers. We also add some lessons. We realize that when advocacies are done to these communities and we reach out to the community leaders who are the gatekeepers, yes, they give their consent and tell us that we are welcome to come for activation events, and we are welcome to sensitize the community members about the activities of the LIDISKI project. But we realize that when they say they will go back and give information to their community members, probably there are so many things to do and then they forget, and they actually don't get that information down to the community members. And so we realize that we have to give constant feedbacks, to these community leaders to ensure that these feedback events are actually organized to ensure that all community members are carried along. Next slide, please. And so for activities that we'll be carrying out in this year, in 2024, so we'll continue the data gathering process, and we'll continue with the stakeholder updates. And so we urge everyone that is participating in this conference, please just check out LIDISKI on social media. You'll see us popping up. And so we'd like you to follow so that you will be aware, you would have access to everything we are doing on the project, particularly as this is the rounding up, we are in the final stages. So you would want to have information as they come up. So please subscribe to our YouTube channel and also follow us on all our social media pages. And we'll also be having a story about the LIDISKI project on the Desira Lift book that is coming, that will be published this year. And then we also have 3 webinars planned. The first one will be on the new protocol that has been developed about Newcastle disease pathotyping. So these are some of the activities that we'll be having this year. We would also be giving feedback to communities where we've carried out surveys. We'll be giving them feedbacks and recommendations, and we would also have more information coming out as the project progresses. Thank you very much. Next slide, please. Yeah, thank you. Over.
Thank
Very
you,
much.
Tommy.
Thank you to both of you, to Marion of CIRAD and Tommy at Corée for this presentation. Was there any comment or question in the audience here about the engagement actions? Yes, Mr. Abachi.
Voilà, merci beaucoup. Et je salue vraiment les activités que la dernière présentatrice a déclinées. C'est un très bon, en tout cas, plan de travail, une bonne stratégie. Ce que je voudrais vraiment, parce que surtout quand elle parle de sensibilisation, information et dans les différentes langues, en utilisant tous les canaux, y compris les réseaux sociaux. Alors, je voudrais partager une expérience que de chez nous. En fait, nous, pour essayer d'avoir en tout cas un bon maillage, une bonne couverture, en tout cas pour lutter contre un certain nombre de maladies, nous avons formé des auxiliaires paravétérinaires. À l'époque, ça s'appelle auxiliaires paravétérinaires. Aujourd'hui, ça s'appelle auxiliaires d'élevage. C'est des éleveurs qui sont identifiés dans les différents milieux, qui sont formés en 10 jours et qui ont un minimum pour comprendre de quoi il s'agit. Et ces différents APV, qu'on appelle auxiliaires paravétérinaires, sont mis en réseau autour d'un vétérinaire privé. Donc, il y a une sorte de maillage, en tout cas d'information, d'identification ou bien de veille informatique par rapport à tout ce qui peut apparaître. Ça peut surtout être le cas des maladies animales. Tout ce qu'ils voient, ils partagent entre eux, ils voient les services techniques de l'élevage de proximité ou le service vétérinaire privé pour essayer de parler, diagnostiquer et l'information tout de suite est reçue. Donc, eux-mêmes peuvent apporter certains soins comme le déparasitage et autres. Donc, vraiment, c'est un truc qu'on a appliqué ici au Niger. Et c'est vrai, maintenant, ça a ses limites avec la nouvelle situation, surtout l'insécurité qui a émaillé certaines zones. Donc, ça devient moins efficace. Sinon, avant, c'était vraiment efficace. En termes d'information, on a toutes les informations par rapport aux différents foyers éventuels. Parce que souvent, ce n'est pas évident que ce soit une maladie. Mais ils alertent quand même et ça facilite la surveillance. Merci beaucoup.
Merci, je vais traduire votre commentaire. So our colleague from Niger was mentioning that they actually have a system quite similar put in place in Niger, although they don't call it community animal health workers, but more like auxiliary of veterinary services. And And well, it's been also very helpful and very important in Niger. Of course, with security issues, now they've been, I guess, less able to provide services. But still, I mean, here it's not only in Nigeria that we see that having communities that are involved and trained in providing services in terms of animal health and linking with veterinary services is very important for the control of animal diseases. Thank you very much for your. Donc, merci beaucoup pour votre intervention. C'est effectivement très proche de ce qui se fait, de ce qu'on essaye de ce qui se met en place au Nigeria, et avec les mêmes problèmes évidemment au niveau sécuritaire aussi. Was there any other comments? There was a comment on the chat from a colleague from Cameroon, stressing the fact that community leaders are very important for sensitization, given their impact and position in the communities. And it's true that every time we do engage with the communities, it's very important that we go and contact local chiefs and community leaders. It's really the way to go to be able to have an impact and communicate with the communities. I think it's something that's quite similar everywhere. Any other comments before we move for a break? So just as a reminder, so this was presentations about how we did engage communities in our actions for the project. After the break, we'll have presentation about all the activities we had to better understand the epidemiology and socio-economic context of PPR and Newcastle disease, and then we'll move to how we are developing tools to have strategies for control and surveillance of the diseases. So as I see there's no more comments, I'll propose to have a break of around 15 minutes. So in 15 minutes, we will start again. So in 50 past the hour, we'll resume. So it's 10:50 here and 10:50 in Nigeria. And I guess for everybody in other countries, make the calculation. All right. So thank you all for joining us. And after the break, we will resume. So 15-minute breaks. Thank you very much.
C'est la fin de la réunion?
Non,
Non, on va reprendre incessamment sous peu
Ok, d'accord.
avec
Merci.
2 autres présentations.
Merci.
All right, we will resume with the second part of our session. And now we'll move to presentations